So I've done a lot of stuff since definitely since a lot of you have seen the video. Um, there was a transplant video a while back that had 720 some views, and then there was another short video in between there that had some views, but I think maybe like 40 or 60. But anyhow, so we went up to Mayo. At Mayo, we seen a doctor who is their head hepatic surgeon, and he also is the guy that came up with the transplant list MELD score, which was a great guy to talk to, an honor to meet him. But his only recommendation was a transplant. And then as I began to start to think about that and talk to some people who have had children who have had this condition and had actual surgeries done to fix this, and called back to ask up at Mayo, their transplant division only takes 6 American and 13 overall insurances. So because of that, the transplant division of Mayo kicked me back to Iowa City, which was extremely discouraging. And the doctor that I met with up there, after I called back and had questions and things like that, would no longer take my calls, wouldn't talk to me, pass me off. So I'm sure he's a great surgeon, just his people skills seemed to lack at that point. So I ended up going down to Iowa City. Iowa City, I met with Dr. Gunderson, who is a hepatic doctor, and Dr. Collins, who is a hepatic surgeon. Dr. Collins walked in the room and said, "I don't take out good livers. Your liver is fine. We're going to look at some other options." And I mentioned Dr. Superina's ligation of the shunt, where they put a rubber band around it, and he mentioned a Rex shunt where they hook it up differently to existing vein that you don't use anymore because it was attached to the umbilical cord. Either way, I had other options. So then for he told me to go to Dr. Superina if I could. I called Dr. Superina's office, his clinic there, and I was told that they are pediatric, they only deal with children, and that I am not somebody that they can work with. Still haven't talked to Dr. Superina, but that's not much of a surprise. Doctors don't seem to have time to talk to patients unless you make an appointment in their clinic. And you have to get through their nurses to even get an appointment in their clinic, which in that particular case seemed to be the problem. But Dr. Collins in Iowa City felt comfortable doing the procedure if I couldn't get in with Dr. Superina with some sort of counseling from Dr. Superina. Now, according to Superina's patients, the procedure to decide whether or not you can have this done is a venogram, where they put a dye in your blood and then watch to see where it goes. I am still pending that. I have not had a doctor do that. I did get, I think maybe the hole was gone, but I did have a liver biopsy where they went in through my throat, my jugular, and went down to the liver, biopsied the liver. I got a little bit of a disturbing call back the other day that they are ready to put me on a transplant list, which is completely not what they were talking about back in June when they talked about trying to get these surgeries. So I explained that I do not understand what happened. I don't understand why all of this has been ruled out and they still haven't done the tests that is going to determine whether they can do any of this or not. But that's been what's going on. It's been quite stressful. We kind of tried to take a little bit of the summer, and after we talked to the doctors in Iowa City who said that they thought that they could do a surgery rather than transplant, that eased our mind a little bit. And we kind of tried to take the summer and enjoy our kids and just put this on the back burner. But now we're back into it, and Iowa City, I'm not sure if they are just not communicating with each other like they were before, or if something has come up that on the biopsy that was really bad, or exactly what. This is Thursday, the 28th, 29th. Yeah, the 28th. But anyhow, next Tuesday, the 3rd, I'm going back to a clinical to discuss with Dr. Collins, the surgeon, what came out of the biopsy and why we have all of a sudden jumped back into transplant, because he was telling me that he didn't want to do a transplant because liver transplant expectancy is about 10 to 12 years. After 10 to 12 years, you become really sick, your liver dies, and you need another transplant. And from what I could find, without insurance and everything, the actual transplant and the time in the hospital and all that stuff, just that period of time, is something like $750,000, which I don't really want to have to try to do every 10 to 12 years. And I mean, this time it wouldn't be as bad as maybe next time. And then you're more susceptible to infection, cancer, just everything, which is another scary aspect on this. So that's what's going on with everything. And yep, so I guess I will try to keep everybody updated when I know more. Thank you. Bye.